I really appreciate you and your team. When a patient tells them a problem in their own ways, correlating to the anatomy of the body or the joint, shoulder joint or the spine joint, so they address it quite well. This only the professionals, real professionals can do this job. So the real professionalism is required in resolving these problems, and I think you have the best team with you. I think you are doing the wonderful job in this area.
So hi, this is Dr Rahul Gulve, physio, certified Austrian chiropractor, nanotherapist and pain management specialist. So today we are with Dr Bhanu Prasad garu, aged about 59 years, and he's a scientist by profession. He's having a frozen shoulder. From past 9 months he's suffering. Along with that, he's having an issue at his cervical spine. He's having a significant degenerative changes. So sir, how is your pain and how is your movement?
My main pain mainly is focused on the shoulder, around the shoulder and the shoulder cuff, and the back side of this. But as such, I don't have much problem pain in the neck.
Okay.
Actually, unless the X-ray shows, I don't feel that I have some problem in the neck region.
Okay.
So this shoulder pain is mainly the problem is if I stretch too much, it is giving the pain. And mainly the problem is I'm getting the sleep disturbance. Mainly at 4 o'clock or so, I get up because of the sleep.
Because of the pain.
But when I sit, it will relax to some extent.
Okay.
I'm on the exercises and doing some sort of a physiotherapy like ultrasound and IFT.
Okay.
Not much use.
Okay.
So I visited you for that purpose.
Okay. So how long you have taking treatment with this physio?
This is about 21 days, approximately 3 weeks I've been taking
So
this.
do you feel any change in it?
It was slightly better.
Okay.
But I have started this cervical traction only 3 days back.
Okay.
So
the pain is so severe, so you need to get up in the early morning.
yeah, main that is the main thing. And mainly I have the discomfort while traveling in the car. I cannot put my belt on. I cannot take anything from the back seat. I cannot stretch like this and take the anything from the back seat.
Can we see the movement, please? Can you please stand up? How is it?
So when I stretch like this, I have a pain here, a little bit of pain over here.
Okay. What about this movement?
This here also I have some pain over here. But when I move here, this time I have the pain.
Okay. What about this movement? Internal rotation? Can you please turn around?
Internal rotation is paining actually. It's paining.
Okay. This is the maximum movement. Can you please do this with this hand? Okay. Good. So when you are doing internal rotation, where exactly you are having pain and restriction?
Basically with this hand, my pain is here, this region.
Okay.
A little bit pain, stretching is here.
Okay.
But whether with this, I'm not feeling any pain over here, but pain is here.
Right. So as this is the first day of treatment, so we have planned 14 visits, so we can clear this problem. Manipulate this shoulder first. Is it paining?
Yeah.
Where? Yeah. Okay. Is it paining more?
Yeah.
So he is having more pain, so that we will not manipulate him first. We will go with the slight mobilizations. Yeah, relax. Relax. Flex this. Just leave. Relax. Yes. Okay. Hold me like this. Relax. Yeah, relax. I am not going to manipulate you. I am just mobilizing. Okay. That's it. Relax. Free. Is it paining?
Slightly.
Relax. Relax. Pain?
Yeah.
Is it okay?
Yeah. Pain.
Pain. This is the free range.
Pain.
Turn that side. Just Turn. That's it. Come back again. Keep your hand here. Okay. Manipulating your C-spine. You get up. Relax. 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 Leave your neck down.
Now okay now?
Is it okay? Don't make it stiff. Relax, relax. Okay.
Yeah.
How is it? Check your movement. This one.
I have a problem in here in this rotation.
Okay. Just get it. Stand up.
Check
Check your internal rotation. One.
Yeah, this is the maximum I can go. Now it's staying here.
Sit down. Any change or is it same? In the movement.
Slightly better. It's vertical, slightly better.
Slightly better. Yes. Breathe. No.
Oh, not much. Yeah.
Okay. Is this okay? Ah. Now check it. How is it?
Slightly disturbing.
Slightly improved. Rotation is improved. Slightly rotations are improved. Range is getting improved. So this is what as it is a first visit, so we are not giving a strong dose. So I think it is a better after manipulating. So we will carry for the remaining our treatment with unique therapeutic approaches, and at the last day, hope we will clear this problem and we will get back. Thank you. Hi, so we are with Dr. Bhanu Prasad Garu, aged about 59 years. So we have completed 14 visits. So this is the last visit. So we have treated him for his neck pain and left shoulder. So how are you, sir? How was your pain before and how is it now after 14 visits?
Yeah, basically I'm feeling much better compared to the first day, mainly in terms of shoulder. I had a lot of, before coming here, a lot of disturbance in the sleep because of my shoulder pain. I used to get up early in the morning, means at 3 o'clock or so. So that problem is more or less sorted out.
You have to get up because of your pain disturbance.
Because of the pain
Early morning, 3
early
o'clock.
morning, 3 o'clock.
Now
So
how
that,
it is?
Now that problem is more or less solved. I have not much effect on that. But when I get up, little bit pain I feel, but after doing little bit warm up exercises, I feel comfortable.
Good.
And in terms of the stretching, still the pain is not totally gone. Still I have some amount, but the things have improved compared to one. The intensity has come down. That's one thing. Second thing, little bit improvement in the movements compared to this thing. I am able to stretch more.
Okay. Can we see your movement? Yes. Can you please stand up?
Do it.
Yes. Can you compare with the other hand? So almost we have reached the maximum amount of movement.
Yeah.
And what about this? You have restricted movement. Can you please turn that side?
This is the hand without any problem.
Any problem?
Whether this the one is going like this. But when I support this, it is going up. This is the brain region.
Okay, great.
So means if I still further do it, I have some amount of pain.
Okay.
But that pain is not a radiating pain.
Okay, good.
Basically,
Turn this side. So you have a restricted movement, end range restriction movement and painful movement.
Painful, painful movement. So it's a very sharp pain earlier actually.
Okay.
It's very sharp. But now it has become a very my intensity. The moment I stop the stretching, it is coming to normal, relaxing.
Okay, good. So you mean to say you have a early morning stiffness a bit, but after doing a small amount of movement, that pain also going off. What about your neck? You have neck pain?
Neck, more or less, it was right from the beginning. I didn't feel a neck as such a problem because the symptoms were not there, except the X-ray was showing some sort of a compression at C5, C6. Otherwise, I was not really feeling, because I don't know whether these two are connected or not, independent problems. But neck-wise, actually now I have a lot of flexibility. That much I can say, because here I felt that earlier it was very hard.
This
region, this region was very hard. Now this has become very flexible. So that's one observation I have followed. Improvement I have seen this.
So you have improved your flexibility and comfort levels. Okay. So the quality of life overall, what would you say?
Yeah, actually earlier I was using either only or a painkiller to go to office and do the day. Whereas now I almost stopped that. I am not using that once I started this treatment. So except that morning little bit stiffness and some of the hard stretches, my rest is almost okay.
So almost you have suffered with pain from last 9 months, and you have tried other therapies too, right? So how many days you have been there for the other therapies?
Other therapies I was doing on and off physiotherapy, mainly ultrasound and IFT most of the time, and a little bit of cervical traction for about 3-4 days before this. Because of this COVID situation, I was not going regularly. The improvement was not up to mark. It was still there. There
in the other clinics. So how do you rate us? How is your satisfaction level?
No. My satisfaction level, I can say that I am treated almost like a 60% is gone. Still, I know that I have to go further to maintain this the improvement whatever I got by doing the exercises and all. But I really appreciate you and your team, because especially your team when a patient tells them a problem in their own ways, like that they actually correlate into the anatomy of the body or the joint, shoulder joint or a spine joint. So then they understand really exactly what is happening that region. So they address it quite well. So if I just say that my hand is paining like this, immediately they correlate somewhere what exactly happening. So they put it up. They exactly press that point or compress those regions and make us to make the movements. So that is actually resolving the problem immediately. So this only the professionals, real professionals can do this job.
Thank you.
Not everybody can do this. Just doing a massage will not really, without understanding the anatomy. If you do massaging, nothing, like it's like my wife doing or my sister or daughter doing, but it did not really work. So the real professionalism is required in resolving these problems, and I think you have the best team with you. I think you are doing the wonderful job in this area.
Thank you. Thank you. Happy with the treatment?
I'm
one more success story added. Thank you.